if walking causes pain from a vascular health standpoint. It could indicate a condition known as peripheral artery disease. Peripheral artery disease occurs when arteries in the legs become narrowed or blocked due to a buildup of fatty deposits, atherosclerosis. This restricts blood flow to the muscles and tissues, particularly during physical activity like walking, which requires increased blood flow to the legs. Vascular surgeons specialize in diagnosing and treating conditions like peripheral artery disease. Here's what they can do. Vascular surgeons can perform various tests to diagnose PAD, such as ankle brachial index measurement, ultrasound imaging, duplex ultrasound, computed tomography angiography, or magnetic resonance angiography, MRA. These tests help assess the extent and location of arterial blockages. Initially, they may recommend lifestyle changes such as smoking cessation, exercise programs, and medication to manage risk factors like high blood pressure, high cholesterol, and diabetes. Vascular surgeons can perform minimally invasive procedures to improve blood flow in the affected arteries. This includes techniques such as angioplasty, where a balloon is used to widen the artery, and stenting, where a small mesh tube is placed in the artery to keep it open. In more severe cases, or when minimally invasive methods are not sufficient, vascular surgeons may perform surgical bypass procedures. This involves creating a detour around the blocked artery using a graft, a healthy blood vessel from another part of the body, or a synthetic tube. Vascular surgeons also provide long-term management and follow-up care to monitor the condition and prevent further progression of PAD. This may involve regular checkups, adjustments in medication, and lifestyle recommendations. Overall, vascular surgeons play a crucial role in diagnosing and treating conditions that affect blood flow to the legs, such as PAD, with the goal of improving symptoms, quality of life, and reducing the risk of complications such as limb amputation. Early diagnosis and intervention are key to managing vascular health effectively.